Now in the record mode, you see these gray buttons, which are the presets. In other words, they are preset tests. When you click the button, the computer automatically knows exactly what instrumentation to use and what settings to use for that instrumentation. The BioPAK allows you to create your own tests by editing, creating, or deleting presets. The way to do that is to simply click on the word presets, and if we'd like to create a test, you simply click on create. This screen here is known as the preset editor. Essentially what we're going to do first of all is give the preset a name, and I'm just going to call this preset JVA and JT for JVA and jaw tracking. We have to tell the computer how long we want the trace to be, in this case it's 10 seconds, and what the sample rate is. You don't want to take a sample rate under 1,000. However, taking sample rates that are higher than 1,000 samples a second will make your tests quite large. The files will be bigger. We tell the computer whether we want to record this as a sweep. In other words, should the data be sweeping across the screen, or as an XY. The only instrument that records as an XY is the jaw tracker, and that is where you see the sagittal, frontal, horizontal, and velocity views. Other than that, joint vibration analysis and electromyography are both viewed as a sweep. We type in any patient instructions. For the JVA and jaw tracker preset, I'm simply going to tell the patient to open and close with the metronome, or with the animation of the face. So we'll type those in here: open and close with cartoon. A little easier for them to follow. Now, since this is a JVA and jaw tracking test, we need to go into the JVA tab and tell the computer it should be recording vibrations when we press this button. And since we expect our patients to be normal, we'll magnify those vibrations 10 times. That will make it a little bit easier for us to see the vibrations. We can always change it after the fact as well. The metronome, that's the animation, we'll want that to move at a normal speed. Now, for EGN, electronethography, that's the jaw tracker, I want to record translations. I want to record vertical, anterior, posterior, and lateral movement. Now, since this patient's going to be opening to their full range of motion, I'm not going to magnify the jaw tracker. We won't be recording chewing or speech patterns in this test. So at this point, I can simply click OK, and you'll see that right here we will have a new button created called JVA and JT. As soon as that pops up, all that we need to do is press the button, and then it will record the way that we set the BioPAK up to perform. I'm now clicking on the button. The BioPAK knows that we're going to be recording maximum opening, since we told it that we were going to be recording jaw tracker with no magnification. So we need to enter how far we think the patient's going to open. And we click OK. Now this asks us to ready the patient for recording with teeth together so the jaw tracker can find centric occlusion. I'm going to skip that procedure simply so that we can jump right into the record mode. I don't have a jaw tracker plugged in right now. But what you see here is the computer begins recording across the screen like this as a sweep. When we're done recording, we simply click accept. Since this trace did not record any jaw movement, it warns us patient did not open to within 10% of maximum opening. Would we like to re-record? For demonstration purposes, I don't need to. But here's the sweep that we've just recorded.